Patients Engage is an online platform which has been operational for 5 years. We are focused on holistic management of chronic conditions and always evidence-based. And we look at the perspective of lived experiences of patients and family caregivers in addition to the medical and the lifestyle changes that are required. Actually, one of the things we saw today was really something that indicates how it's important to get the right information and to leverage that information to learn to manage your condition better. So I really liked this diagram that's going around. And I think it's also relevant in general in life, but also during COVID-19, where there's a lot of fear. So we need to select the information carefully and move towards growth phase. And as part of that, we are here to help you in terms of getting the right information. And we've been doing these series where we talk to specialists, we talk to people with lived experiences on how to manage their conditions better during this difficult times. So today we have with us Dr. Vijay Kher, who's a nephrologist and a renal specialist. He's also the chairman of Kidney and Urology Institute of Medanta Hospital. And we have Samiir Halady, who's had a kidney transplant, and he's with the Amar Gandhi Foundation and working very, very actively on helping patients address their issues that are there. So we'll just quickly talk about, I'll just get rid of the slides, and we will talk about the issues that are that we can address for people who are dealing with renal problems. Just a quick reminder, if people would like to ask questions, they can either ask on the Zoom Q&A or the Zoom chat. And if you're following us on Facebook, you can ask it on the live feed, and we will answer those questions to the best of our abilities. This does not replace a medical consultation. So, this is guidelines for you to follow, but also if there's a specific requirement you have, please do consult your doctors. Doctor, thank you for coming. And I think the first question that people have is really, are kidney patients more vulnerable to the COVID-19 infection?
Well, I'm glad to be here actually, and I must compliment you, Vasundhara, and others to be able to bring people like us and engage with a larger community of kidney patients across and try to filter for them at least the right kind of information, what is good for them at these trying times. And I think as far as kidney patients, their vulnerability to get infections, obviously their immune systems are low, so they are always at high risk of getting infections. But as far as whether they are specifically at high risk of developing COVID-19 infection, I think there isn't any evidence to suggest that if they get exposed, obviously there is a risk to any other person as well to get a COVID-19 infection if they haven't taken the right kind of precautions. So kidney patients are also at the same risk. But I think the infection rates probably may be very, very similar to the rest of the population. They may not be more. But as far as complications of this disease are concerned, kidney patients might be at a more vulnerable state to get a more complicated disease, or they may not have their reserves in the body by which they can fight the complications of these infections. And I think that's why kidney patients need to be more
careful. Doctor, there's a request to increase the volume. So if you can kind of speak up a little.
Increase the volume?
Yeah.
Okay. I had actually cut down the voice. I hope it's okay now. So what I was saying is that I think kidney patients are probably at the same level of risk for development of COVID-19 infections as would be any general population. But these patients, probably the reserves to fight complications are going to be limited. And that's the reason these patients need to be more careful about trying to prevent infections. And I think that's important. And I think That's both transplant patients as well as patients on dialysis or kidney disease not on dialysis. They are all at higher risk of developing. Uh, if they develop complications of these diseases, then they may not be able to cope with the complications more and may have a higher kind of mortality.
Right. Thank you. Thank you. Um, Samiir, in your experience and what you have been trying to figure out solutions for or helping patients in various cities, can you talk us through some of the challenges that kidney patients are currently facing?
Yeah, so there are actually two types of challenges. The challenges that are currently being faced and we know of. And secondly, there are challenges that could come up. So I'll just talk about the current set of challenges. So number one is police stopping patients from getting to the hospital. This is for dialysis patients. Secondly, technicians not attending because of fear of infection themselves, or maybe transportation availability. Again, transportation availability is a prime problem for dialysis patients because there are no cabs or autos flying. Uh, and then there is one thing that could happen in future, that is availability of medications, because there are no people to deliver the medicine. And number two, just in case a dialysis patient gets infected with COVID, then firstly, in most hospitals there is no COVID facility. So if you get infected, then you have to move. And if that hospital where you move for a COVID infection treatment doesn't have dialysis facility, then it's a major problem.
Right. Okay. Thank you. Um, so I guess uh, are there, if you let's look at the issue of transportation and police, so what are the solutions that have currently been worked out, or what's working out for people in the various places?
So I focused on Bombay because I'm living here. So here, first problem was police not allowing, and then
Right.
there was sudden disappearance of public transport. So luckily, I got through to some senior politicians, and they were really helpful,
Hmm.
and they gave me all the details of public transport that would be plying, along with the timings. Secondly, the police commissioner, I contacted him through ex-DGP of UP, who's part of the Kidney Warriors group, and he deputed somebody to help me. So I am in regular touch with him. Uh, so if there is, firstly, we started a system of having certification. Hospitals are giving certificates to the patients, which they carry on their person. If a police stops them, they just show the certificate. Secondly,
Right.
what we did was we requested the hospitals to share the information of all the patients taking dialysis with them, and I forwarded that to the police people. So they have something to cross verify the names. So now, more or less, that problem has been streamlined. Although there would be isolated cases where patients are stopped, but more or less, right up till the lowest level, awareness is there about dialysis patients and their need to take dialysis.
Right.
Uh, Second was availability of public transportation. So for public transportation is was really a major issue. So uh, today, what we have done is, at least for South Mumbai and for western suburbs, we have tied up with transporters, basically car hires, as well as a social service organization, which is voluntary. So they have a group of volunteers who, when called upon, so you have to give them notice period, say 24 hours, and they will organize for the transport. So it started functioning, but I need to just be sure, because they see, most importantly, there is fear. So if
Right.
somebody even volunteers to take to ferry patient, their family might object to it.
Correct.
And to get this to other parts of the city is taking time, because. But today I can confidently say that these regions or these localities are streamlined, and we would take it to other parts of the city very soon.
Okay. Thanks. uh, Doctor, there's also the fear that patients have of going to these dialysis centers, either because of the risk of infection or just because there is all this kind of trouble they have to get through to get to these places. So are you seeing patients reduce their frequency of dialysis? Is that how would you ask them to recommend that they handle this?
Yeah, I agree that that can be a problem. When I look at my unit, both at Medanta standalone unit as well as in the hospital, we've been educating our patients that they should not worry about getting a COVID infection in the dialysis units. We have changed the distance between the dialysis patients slightly, somewhat altered. Although the regular dialysis unit has more chairs or beds close to each other, they're not separated that well. But because of the COVID infection and the fear that patients have, we have done that. The interbed space has been widened so that the distance between the patients is as per the COVID guidelines as well. And the precautions which usually a good dialysis unit should take should be good enough for a
Right.
patient. And I think it's very important for patients to tell the the doctors and the technicians or nurses that if they have a fever, if they have a cough, if they have any symptoms which suggest that they may be infected, I think it's very important to tell it to the patient, not hide it,
Right.
because they fear that they may not be dialyzed if they get a COVID infection. I think what many hospitals will do will be to provide a place separately for COVID patients, but we will dialyze them. I've educated our patients, talked to them many times over that don't be afraid that if you get a COVID infection, you may not get dialysis done in a hospital. I agree that all hospitals, as Samiir was talking, all hospitals may not have all the facilities for COVID. You might have to get transported, but the care, fortunately, in at this point of time, has been taken care of by most of the governments. Are saying that if patients get infected, they will take care of the patients' hospitalization as well as care during this COVID infection. So dialysis will be provided. I think that should be ensured, and patients need to be reassured on that front. But they must open out and talk about it, because if there is an infected patient, then we want to prevent these infections going to the other patients. So that's very, very primary. Now, as far as reducing dialysis, because either the facility for going to the dialysis unit is not there, or they
Mm.
are having trouble finding transportation, as well as the fear of dialysis. So many patients have asked me whether they should cut down the dialysis numbers. If they were going on for 3 times a week, can they cut it down to twice? Or if they were on twice a week dialysis, can they cut it down to once a week, or miss dialysis? And my general advice to people is that actually most patients on dialysis will have other conditions, comorbid conditions.
Mm.
Many of them will have heart disease, many of them will have liver disease, strokes, hypertension, diabetes, and therefore the complications of poor dialysis or inadequate dialysis will be far more difficult for them to manage, and will get them into the hospital. They will have to get admitted because of the complications of fluid overload, uncontrolled blood pressure, heart failure,
Mm.
and therefore at a higher risk of developing COVID or getting a COVID infection if they get into the. So I think it's very important for them to balance this,
Right.
basically, because if they miss dialysis, they will have to get admitted for complications of inadequate dialysis. And I think they should avoid that during this time frame. And therefore, try as much as they can possibly. If they are having a transport, then they should be able to go to the hospital. Ensure they must keep their eyes and ears open that the technicians and the nurses are taking care of adequate precautions with sterilization and other precautions. Ordinarily, good routine dialysis practices should be good enough to prevent spread of COVID. It's only when these guidelines are not taken care of, if the patients haven't been dialyzed effectively in good dialysis units, then there is a possibility of spread of COVID infection in dialysis units.
Okay. Thank you. Thank you, doctor.
Okay.
Can I
Let us.
can I add something here?
Sure. Sure.
Yeah, yeah.
So one more issue that dialysis units, at least in Mumbai and maybe in Bangalore, are facing is availability of things like fluids or consumables. So today, because there is this lockdown, transportation is not available, and especially in Bangalore, uh, the government has started something called an e-pass for transporters carrying essential services. And this e-pass is actually you have to go to a website and get it done. But somehow I think the website is not working. So these are the hurdles. I appreciate that the government would have done it in a very short span, but these are the hurdles that are practical. And because the transportation is not running, then the consumables are not reaching the hospitals in time. And that is because of lack of consumables, patients might suffer because the hospitals might not be able to give dialysis. Again, technicians. So there are a lot of technicians who are not reporting to work because they're scared. So yes, it is an essential service, and they have to work. But then human life is also important, and so these issues are actually weighing a lot on minds, and as well as and end up being constraints for dialysis centers.
Yes, Samiir, I think you raised a very, very important point. And I must say that the nephrologists and the doctors need to talk to their technicians and nurses, reassure them. And hospitals will have to do that also, that if any of the healthcare workers gets infected, and they need to be reassured that they will be taken care of, their families will be taken care of. All these are extremely important steps if any of these people have to come to the hospital to take care of patients. And I think it's very, very important to keep on building their morale and their well-being as well, and need to keep on talking to them frequently. And I think that's very, very essential to keep the morale of the technicians and the nurses up in the dialysis units as well as patients. Sumit, very, very
Right.
important point.
Thanks. And I think we have one comment or a recommendation. Can we also issue some manuals of do's and don'ts to all dialysis centers who can then educate patients and also staff? And they've given an example, especially centers like Siddhi Vinayak and Lal Bagh, where hygiene is to be maintained. Reason is they do not refer to any sites or social media and are not aware about facts and associations. So doctor, is there, like for instance, when we did the session on rheumatology, they talked about there's the Indian Rheumatology Association
This
which is sending out guidelines. So I
no,
guess there
there
must
is
be
an
something for
the
nephrology as
Indian,
well.
yes, the Indian Society of the kidney disease is also given guidelines for patients with kidney disease, doctors as well as hospitals, for how to manage patients with COVID infections and how to manage patients of kidney disease in the epidemics of COVID infection and all that. So there are guidelines which are already on the website of the Indian Society of Nephrology.
Okay,
It's there on the website. It's been recently made, and so these guidelines are available. In addition, actually, there are large number of guidelines which are coming every day.
true.
We already have a set of guidelines set by Medanta itself, which we made for the hospital, and so the technicians and the nurses and our units as well as patients are aware of what is to be done in case there is a COVID infection, in case and in all other group of patients, so that the care that needs to be taken to these patients is given. So I think this will be a continuous kind of an effort. I know there would be centers somewhere they may not have an access to these kind of things, but I think patients these days themselves need to get educated fairly well, and that's I think patient engagement like this will definitely help them to get educated, so then they demand that kind of care of their patient.
Right, right. Thank you. Um, there are a couple of comments which have come up, and I think they're valid, of course. This pandemic has opened up our eyes. We need to have a proper disaster management system that includes dialysis patients and other patients too. And in
Very
such
right.
situations, the government should keep a plan ready for people in case of emergency. So I think, yeah, that's one of our observation as patients engage, is that essential services needs to look beyond food and just medicine, and look at all of the services that are needed as well. And we still have a long way to go in terms of standardizing of helplines as well. So I think that is our
Uh,
observation, that's and across various conditions, to be honest.
Yes, Aparna, in addition, would also want to say that I think it should wake up the governments also, that the general care of healthcare
Mm,
which one finds abysmally poor in many places, needs to go up. I think our expenditure on healthcare must go up.
True.
It's abysmally very poor. The government expenditure is less, about 1.5% or less.
Yeah.
The
Yeah.
government did say that it's going to increase it, but I think we need to substantially increase the amount of
Outlay.
money that needs to be
Correct.
spent outlay for the healthcare, and I think that's
Absolutely.
very important.
Can I
Absolutely.
add a little bit here?
Sure.
Actually, yes, from what Aparna said, we need a policy in place from the central government. Very true, because I am working for Bombay and now I have to replicate all these things for other cities. And I am a new transplant recipient, so I cannot travel. So I have to
Mm.
anyways get it done from somebody. But yes, what I must mention here is that uh, government has been very receptive and responsive. So whenever I have approached the government for any kind of help, they have always supported us. I think it's just that the whole thing happened, and this is an unprecedented situation, and so it is really difficult for the government to prioritize. I think right now their priorities would be to move the food supplies to all the parts of the country, and because that is going to benefit more of the population. So yes, but we have to be prepared. So I think Aparna made a very pertinent point that we need to have a policy in place that in case of such kind of instances again, how do we handle it?
Yeah. Yeah. So let's move to transplant as well. I think we've talked a fair bit about dialysis. One of the questions that we have received is in terms of, because transplant patients are often on immunosuppressant drugs, does that put them at greater risk? Do they need to change their medication? So, doctor, anything on that?
So I think transplant medicines, the immunosuppressive agents are essential for sustenance of this graft and this
Right.
kidney. And I think it's very important for them to continue to take their medicines. What might happen, as Samiir was talking about, is the availability of the drugs. Their drug supplies may excuse me, they may have finished, or they may be short of drugs, and then can they reduce their drugs or can they stop their drugs? I think it's extremely dangerous for a transplant patient to miss their drugs, and I think it is difficult to predict that these patients are very likely to lose their grafts if they miss their drug. So
Right.
my advice to patients usually is that if they are short on medicines, then they should increase they should try to get the supplies from wherever they can. If they know about a patient who has maybe more of these drugs available for some period of time, if they can get it from them, if they know any supplies where they should. Ordinarily, we tell our patients to keep the supplies for a longer period of time, and so that they are served in situations like this. But those patients where the medicines are not there, and I would suggest that they should increase the dose of steroids. Steroids are very easily available. The prednisolone, Visalone, or Omnicortil, these are the brand names of these drugs. These are easily available drugs from the pharmacies. So this drug should be then increased. If they are on 5 milligrams of this, they should be increased to 10 milligrams. If they are on 10 milligrams, they should be increased to 15 or 20 milligrams for during this short period of time. My
Right.
general advice to them would be not to discontinue their drugs and continue to take their drugs. Many of them have an impression that if they continue immunosuppressive drugs, then they might fall prey to
Mm.
increased incidence of a COVID infection. No,
Correct.
that's not true. As I said, that the infection rates are not very different in patients with transplant or general public. As such, if they are exposed to the same level of infection, they have an equal chance of getting the infection. It's the complications, the reserves that the immunosuppressed patients do not have, that's what will make them to suffer more from if they get COVID infection. So that's where they should stand. So they should continue their immunosuppressive drugs. They should not change their immunosuppressive drugs at all,
Right.
because if they discontinue, they might have to get admitted to the hospital for an acute rejection, kidney
Mm.
dysfunction, and many other complications. And that's what one would want to avoid at this point of time.
Okay. Thank you. There's
Right.
just one comment that's come that few centers have been temporarily shut down. And there's an example of Piramal in Lower Parel. So patients are facing challenges trying to contact dialysis centers. In such cases, substitute centers should accept these patients. And if yes, then what protocols are to be maintained to keep hygiene and healthy environment in center with existing patients and also for new coming patients? Have you faced any issues like this, or any any
No, no, there,
concerns from dialysis centers not wanting to take patients that are not regularly theirs?
Uh,
yeah, there,
yeah.
yes, Samiir, go
Doctor,
on.
please go on.
No, I was saying that there was just today morning itself, there was a patient who wanted to come to our center in Delhi, and there was the technician wasn't very clear on this, and I told him, no, if we have a space, then there is no reason why we should not accept that patient. We should definitely examine that patient and try to look at that he doesn't have a, because there may be patients who may hide that if they have a COVID infection, they've been told not to be taken for dialysis in that center, then they might look for centers without telling them that they have a COVID infection, which
Right,
is not right. Which
right,
is not right. Every patient must declare if they have a COVID infection, because they need isolation and you need to protect all other patients from COVID infection. So I think it's very essential for patients to be frank about their disease. And we examined that patient, he was good, and there was no reason to deny that dialysis. I think most dialysis units, if they have capacity and they have slots available for and have capability to increase the slots of dialysis, should accept patients, examine them, be more careful about new patients. Obviously, you have to protect your own dialysis patients, but as long as you are taking precautions, you should be able to accommodate patients.
right. Okay,
So,
thank you. One more question. If in case a kidney transplant patient gets diagnosed with COVID-19, would government doctors know how to tackle this scenario, considering that immunosuppressants needs to be given along with other treatments?
yeah, I think most doctors, many of the doctors in the government hospitals may have a nephrology service and a transplant physician on board, or then that might help them. But I agree that there may be centers where there may be no experience of managing such patients, and I would feel that they should, or sort of the patients themselves must tell them that this is my doctor and get in contact with that doctor. So I think their primary physicians must get in contact with the treating physician in the government setup,
Right,
and should help them to navigate these patients of transplant. They need navigation of drug management and certain other precautions, which I think are important. And I think I would request patients, those who get COVID infections, should uh, give a connection between their primary transplant physician and the doctor who is taking care of him in the government hospital.
right. Okay, thank you. Um, in case there are any patients whose transplant, was scheduled or is now delayed, uh, or the whole process might get delayed, I guess for them they just continue on dialysis, or what is?
Yes, yes. Many centers, including ours,
Mm,
we have stopped regular transplants.
right,
Transplants which are, if there was somebody who had already been given an injection like an ABO incompatible transplant, and the date was already fixed, because there is a process of removing antibodies for ABO incompatible transplants. So transplants cannot be postponed. So
right,
those transplants we have done.
right,
But regular transplants we had stopped. So we tell patients to continue on dialysis till that period of time. And the moment we feel that it's safe to do regular surgeries and do transplants as well, we will start doing transplants. And that's what many centers across the world have done. The regular transplants have stopped in many of these places, and
Right.
therefore they should continue to get dialysis done and not miss their dialysis.
Okay. I guess this is probably not really for this forum, but I'm just raising it because it's been asked. As the pandemic has caused joblessness to many kidney transplant patients may not be able to buy at full price or even at existing discounted price. Uh, would can medical manufacturers be reached out to reduce the cost for a period of 3 to 6 months? I don't know if the I guess this is
Yeah,
something that the Kidney Warrior Foundation can probably try and take up
I think
on
maybe
behalf.
we should take up with the government, and
Yeah.
it could
But
be
this is
kind
a
of.
real problem.
Yeah, no, I
This is a
think this
real
is
problem.
going to be a real problem, and going forward, uh, it is a genuine issue for sure. So
No doubt about that. And I think maybe Kidney Warriors, along with some of us,
yeah,
should push it to the government and the authorities, both in center and maybe at local levels as well, because health is a state issue. So we might
correct.
have to work and fight for these patients, and I think something might come out. We don't know.
Right. Yeah, I think it's definitely worth kind of looking at how we can
Looking
support
at.
patients who are going
Sure,
through this.
sure.
Um, okay. Okay, so one question that I had, Doctor, was that, while people are going through all these difficult times and whether it is slightly reduced or not reduced, dialysis, etc., are there other precautions that patients can take in terms of diet, in terms of, regular lifestyle changes to manage their condition better?
Yeah, I think especially if there are patients who perforce, despite their wishes, but have to cut down their dialysis or are not able to do that. I think they need to be careful about their fluid intake as well as salt intake. They
Mm,
must be careful that they must continue to take their drugs, especially the blood pressure medicines and other medicines, so that they do not aggravate their clinical conditions to such an extent that they need to get hospitalized at this point of time. That
right,
would be the last thing that one would want to do. So therefore, it's very important that if per force you have uh, been forced to reduce your dialysis, or therefore you should continue to take your medicine, cut down your fluid intake, and adhere to the dietary restrictions that have been told to you, especially about the salt and the potassium, because these are two things which can create problems in a patient with dialysis or those patients with chronic kidney disease. So I think it's important to be more careful about your diet and all that,
right,
more strictly during these days.
right. Okay. I don't think we have any more questions as far as I can see. Samiir, you had anything else that you would like to add at this point? Any points that we didn't cover in terms of the work you're doing?
Hmm. Okay, so I was just thinking that it's an appeal actually. So we have one transport operator who's actually come forward, and despite risks for his drivers, they have offered things at a very concessional rate. So if more private taxi or private car hirers come forward to help patients, I think that would make a lot of difference. I am talking to a national taxi service provider, and I'm expecting something to happen. I hope something happens very quickly, so that things can be. It can be a solution for more number of patients across the country.
Right. Okay. So, are you appealing to people
I'm
as well
appealing
to?
to people who, yeah, people as well. So even if people can volunteer, see,
Right.
there are risks, yes, but then there are ways to sort of, take care. So if you have sanitizers, so the person whom we have tied up with, he's actually providing sanitizers in the car. Plus, all his drivers are having gloves as well as masks.
Right.
So I think these kind of precautions, if we take, then we are we are actually reducing the risk. I will not say we are eliminating the risk, but there is
Yes.
a way out. We have to help each other in these times.
Correct. Correct. No, I think that's a good point. Yes. Um,
The
Go
other
ahead.
point, Aparna, which you refer to it in the earlier part, is that the information that is available
Right.
is so huge, and there is a lot of misinformation available on the net. And I think it's very important for people to realize that they must sift out the true information. And it's important, sometimes there are a lot of things which are written which are not right,
Correct.
and
Correct.
they should not necessarily trust everything that is coming onto their WhatsApp or any other sort of chat groups. So I think it's very important to be careful about what information you need, and do confirm with your physicians whether the information is appropriate for you or not. I think it's very, don't start drugs which are being said that they will prevent COVID infection or something. Don't do it on your own.
Right.
Please ask your physicians always before you start anything new, whether it is related to COVID or anything else. Do not do it without contacting your physicians.
So that's a good point. Are you getting requests from patients whether they should start taking HCQ?
Yes.
Right.
Lot of such requests, because
Right.
they've read somewhere and they send me information also, that
Right.
this is where they've got this information. And so that's important. So I think it's very, very important that people should not do it. There have been deaths related to these drugs, and
Correct.
so it's very important who is the patient, who can take it. Even everybody cannot be given this drug.
Right. Right. So we have a request. I mean, we have a question. Can a transplant patient be a volunteer to support dialysis patients?
At this point of time, I would suggest that as much as they can do from outside, other help, but I would feel that transplant patients should, at the moment, try to avoid, if they can, be away from the hospitals. That's what my fear would be, that as they are high risk group from the point of view which I explained earlier. So I would suggest do something like what Samiir is doing, and I think that's the kind of help which would be extremely useful to the community of chronic kidney disease patients.
Yeah,
Yeah.
I was actually about to say that. So if you really want to help, please contact me, because we need people across the country to move things with their respective state government.
Right. Yeah. I think that's a good point. There are ways to volunteer, and there are platforms these days, especially digital platforms, which are doing a good job in terms of getting volunteers together as well. And if anybody needs ideas, you can also reach out to us. We're always connecting people to where they can. So I think that's kind of it as far as the questions are concerned as of now. Thank you, Doctor, and thank you, Samiir. Let me just do a quick, recap of also just to let people know that tomorrow we will be doing a session on how to prevent back pain and neck pain because people are working from home and binge watching. And also on Friday, we are doing a diabetes management session, especially again, as far as this is concerned. And I think we've talked enough about the guidelines and, caregiver passes, curfew passes, etc. But I think just be responsible, stay at home, ask for help if you're feeling anxious, and do let your community or your kind of network know, because one of the issues we are hearing very strongly is the fact that blood banks are depleting in many cities. Delhi and I think Bangalore are the two biggest hit at the moment, or at least the ones we've seen, because the voluntary blood donation camps are not happening. So I think there's a couple that are on the horizon. So just kind of keep an eye, or let people know if they want to. Not, I guess you guys can't, but let your families and friends know. So thank you, Doctor. Thank you, Samiir, and
Thank
thank
you.
you,
It's a
Preeti,
Thank
for
you.
pleasure.
this.
It's a pleasure.
Thanks
Thank
for
you.
having me here.
Thank
Yes,
you.
it's a
Okay.
pleasure, Aparna, and anytime,
All right.
please don't hesitate to
Yeah, no, I
press
think
it.
there's a
Thank you.
request for these sessions to happen more frequently. So we'll work out and how we can do
Yes.
that as well. Thank you.
Thank you.
Thank you. Let me
Thank
stop
you.
the live stream now. Thank you, everyone who's watching.